So we are back. Good morning once again to all our followers, our viewers here on Emonews this morning. Like I told you earlier, today we celebrate World Diabetes Day, although we're celebrating entire month as observance of Diabetes Month. But today we are with Dr. Ricketts, where she is breaking the barriers and bridging the gaps, and we are here to speak with her again, and we have a client who will also be speaking with us, so stay tuned. So Dr. Ricketts, we are back. So tell us now, what are we going to see? What are the viewers going to be viewing with your client this morning?
So this morning, we are going to be doing a fundus photos, take a picture of the retina, which is the nerve lining inside the eyeball. This is the area that diabetes affects in patients who have diabetes for a long time, or it is poorly controlled, or they have high cholesterol. These are the risk factors. If they're pregnant, if they're smoking, and so it can cause blindness, a preventable cause of blindness. And so to prevent blindness, we screen, and by screening, it means that we are trying to detect the disease in patients who are asymptomatic, meaning that they have no signs, no complaints about their eyes related to diabetes, but they may have retinopathy. So screening is to detect retinopathy in patients who are asymptomatic. And here we have the this equipment here that takes the picture of the eye, and if the photo shows that they have retinopathy and it is involving their macula, we can do what is called OCT, or optical coherence tomography, which is like a little CT scan that gives us a cross section of the retina to determine how much damage is going on, because this will indicate whether these patients need to have interventions like laser treatment or injections with anti-VEGF to cause the disease to regress and to save their vision.
So we have our client here this morning. Let me allow her to introduce herself. Good morning, and how are you? You're
Good,
live on Emonews.
good morning. My name is Kanya Nelson. I'm a staff nurse. I am based at Newton Health Center. And today I am here, Dr. Ricketts. I came to have my fundus photo done because I have been diabetic since about maybe 18 years after through pregnancy. And I'm so grateful that Dr. Shillingford chose today to give back to the public and to give back to diabetics, especially that they can have their eye checked and check in time before we go blind. Because one of the complications of diabetes, if you have prolonged diabetes, you have diabetes for many years, and has been poorly controlled, as she has already said, can cause blindness. And as a result, you want to have your eye checked, because you may be going on and not have any symptoms. As you say, you may be asymptomatic. Having no symptoms, maybe you haven't got any pain or blurry vision or so, but because it is retinopathy, you may not have that feeling or that sensation. So it is important, very important, I should stress, that you have your eye checked so that we can at least save us from blindness. So I am so grateful, and I guess on behalf of all the other clients that will be coming in, I want to say thank you to Dr. Shillingford for taking that initiative and for giving back to the public freely. It is free. So make use of it. Take advantage of that moment. She is giving back, and that we are grateful, and we pray God's continued blessings upon her and her business. I thank you.
Thank you very much, Mrs. Nelson. So right now you've heard from Nurse Nelson, and we're now going to do a demonstration how how it's done.
So here is not easy. And this is your band.
So, Dr. Ricketts, you can give us an idea what is happening right now?
Well, before the patient was put on the machine, they've got to be registered, their name and their ID number, and so has to be entered so that their photos can be correctly identified for when it is stored on the computer, and then they they're going to focus. But before that, the pupil was dilated, meaning it just made bigger so we get a better view of the retina. And so now she is focusing on the, and she's giving the patients instructions. The patients will be seeing a red line in the machine. So when they look at that line, it will help to align their eye properly so that the machine can take the photo.
So, Dr. Ricketts, the patients you have seen.
She interfered with her.
Okay.
I'm going to bring up a green X, okay? So just keep looking directly at the green X. For the green X, do not blink.
What is that having that? And then you let us clean.
Yeah, come right.
Just here at Dr. Ricketts' office, demonstration. Of the eye. All eyes is
Can you repeat it, please?
has decided to demonstrate here at Dr. Ricketts' office how it's done.
Hmm? Okay. Yeah. Okay, really right right now.
And Dr. Ricketts is breaking barriers and she's bridging gaps.
You have to repeat
Today,
it.
World Diabetes Day. She has free screening for diabetic retinopathy. She has free optical coherence tomography. There will be free laser treatment for diabetic retinopathy to those who are identified as needed it from the screening sessions. So you have the opportunity to call the office and you can get these free services provided to you on the 14th, which is today, the 21st of November,
Can we take
and
it
the
out?
28th of November 2024. These free services will be
Yeah,
available after screening
lens cleaner.
at Dr. Ricketts'
But because
office
I
at
don't like that
Hasbro
a shadow
Medical
there.
Center. So all this is to raise public awareness about this chronic non-communicable disease, diabetes, and it is an increasing public health problem. So you need to make that appointment and you need to come and get your eyes screened. It's open to all ages. And Dr. Ricketts is also planning to empower diabetics
Yeah.
to manage their disease through education, to make quality care available and affordable, accessible and equitable to all diabetics. So don't feel that you cannot come or you don't have the funds. You can come to Dr. Ricketts Shillingford's office. You can call, make an appointment, and she will definitely assist you. It's very important that you check your eyes. Diabetes is not only for the other parts of the body, it's also the eyes can be affected. And I know none of us would want to become blind at an early age. So
Much
if you have the
better.
young ones,
Okay, we're going to do the left eye now.
you take them in for screening at the office. She's located in Hasbro Medical Center. So we're seeing how the screening is done. One of the patients, Nurse Nelson,
Okay.
she's here today to get her screening done.
Give me a full. Okay, next you want to come on this side for us to discuss your results. You can sit back and come here.
So the screening is done and the
Yes.
patient will be.
So what we do after the screening, we have to counsel the patient, which means we have to show them their photos, explain to them what the findings are, and indicate to them whether they need treatment and what treatment they will need. If they don't need treatment, then they will be informed as to the follow-up appointment to check for their retinopathy. Okay, so this is what we're going to do.
So Dr. Ricketts, we want to thank you for allowing us to come here at your office this morning, and we want to thank patient Ms. Nelson for allowing us to have a live on Emonews. So we just want to encourage you to come. What is the contact number again, Dr. Ricketts?
Okay,
For the
so
office?
it's 275-1665 or 449-8556. 8565, sorry, 449-8565. And I would like to thank Emonews again for partnering with us to bring information to the public. And today, Diabetes Day, we would like to educate our diabetics to empower them as to how to manage their disease. And we would like also to bring quality care free of charge to them so that they know they can get a treatment to prevent blindness from diabetic retinopathy. And to our listening public, thank you very much for the support over the years and working with us as I strive to ensure that patients have good vision or restore their vision or prevent them from getting blind. Thank you.
Thank you very much, Dr. Ricketts, and thank you to our viewers. We now sign off. Have yourself a blessed day.